unfortunately, patients will often present to a gynecologist and they know their tubes she's been sterilized, and they then say to the doctor, I'm here to have my tubal reversal. And the doctor looks at the patient and says, okay, we'll do you on Tuesday. And unfortunately, by right, if someone requires a tubal reversal, the patient should seek help from a reproductive medicine specialist and go to a fertility clinic and get that advice, because any doctor is willing to try and fix your fallopian tubes. And what you need to know is you need to be sure that you are young, preferably under the age of 38. We need to know how you were sterilized. We need to know that you don't have other problems like fibroids or something else, scars in your womb, or lots of other things that can actually stop you from falling pregnant. So you've now gone and had your tubes reversed, but you still can't fall pregnant because the doctor has not looked at the other aspects. And the most important thing is, don't go and do a tubal reversal if you haven't yet checked your partner's sperm. Now, the actual figures of what are the chances that the tubal reversal will remain open, and what are the chances of me conceiving spontaneously. And unfortunately, a lot of the studies are old studies, okay? And a lot of the studies were done before IVF was available. And yes, granted, IVF is more expensive in a way, but at the end of the day, your success rate with IVF may be much higher than what you would achieve if you had to have a successful tubal reversal. The important thing about who the surgeon is that does your tubal reversal, it needs to be done by a doctor who has microscopic skills, who knows what he's doing or who she's doing as far as reversing fallopian tubes, and not being done by a gynecologist who does one every year. It needs to be done by someone who specializes in the field and only does tubal reversals. So it's not that simple on the one hand just to unblock your blocked tubes. You also need to know that you have a 5 times higher chance of an ectopic pregnancy if you conceive naturally after the surgery for reversing your sterilization. So that is high. The one way to get your ectopic rate down is to do IVF. But yes, with IVF, there is still a 1 to 2% risk of ectopic. But if you do a tubal reversal, there's a good 10 to 12% risk that you'll have an ectopic pregnancy. The beauty in the way of a reversal is that if it does work, you've at least got a chance to have another child naturally. But again, the chances of it working is nowhere near 100%, and depending on the female age and the quality of the sperm, it possibly may be even lower than 18%. But there are some studies that will say there's up to a 44% chance that you can be successful. And there are even studies that say, well, even if you're 45, you should try it, which us as fertility specialists would definitely strongly disagree with that. But certainly the jury is not out on that. So my most important advice would be, number 1, get a correct opinion. Number 2, be worked up correctly. Don't just dive in and have a tubal reversal without having all the other pieces of the jigsaw puzzle in place. You will need an X-ray of your womb to try and evaluate how much of the tube is still there connected to the womb. You will need to have a semen analysis, so at least you know you have a husband who's got a partner who's got a good sperm count. And you will need to make sure that you still have a good egg store and look at your own age and understand that once you've done the reversal, you don't get an immediate pregnancy within the first month. So there is a lot to consider. Be wary of a doctor who's willing to do it for you the next day. Ask the doctor, how many sterilizations reversals do they perform in a month? And if they hardly ever do it, stay away. And I think that's very important advice. And please, everybody, take heed of this advice. And yes, we know that you want to have another child and you need to unblock your sterilization. And at the end of the day, you'll do anything to do it. But just be sure that you've done your homework before and you've got all your questions answered and all your tests done correctly. And then I would say, okay, go ahead.